seeing the expansion of that sequencing, which we're putting in place to increase it further. It's only because of that capacity that we were able to find these 6. In most other countries in the world, we simply wouldn't have known that that had happened, and therefore we were able to track all 6 down. Dr. Hopkins.
Thank you. So I think the challenge about borders is that people coming into this country at the moment and leaving should only be doing it for essential reasons. And as you know, only people who have a British residency or a British passport can come in from many countries right now. In addition, the day 2 and the day 8 tests while people are in quarantine give us extra reassurance of being able to detect cases. And we are also whole genome sequencing any of those that can be sequenced. All of that is really positive because it allows us to find any of these variants coming into the country earlier, trace any of their contacts, trace people on flights as we did for the previous cases. And that gives us a lot of reassurance that even with small numbers of individuals coming into the country, that we can minimise the risk to the public health and to the population.
Thanks very much. Next question, Nigel Morris from the Eye. Nigel.
Secretary of State, the PM said all the way back in July 2019 that the government had a ready-made plan for fixing the long-running crisis in social care funding. And yet his press secretary said yesterday that you still had no detailed proposals on the issue. Could you finally give us a firm date when your social care reform plans will be produced and update us on what cross-party contacts have taken place following your call for cross-party consensus on the issue? And secondly, very quickly, could I ask, was consideration given to a one-off bonus to NHS staff as is happening in Scotland? And if so, why was the idea rejected?
Well, thanks very much. Obviously, solving the social care funding issue has been a long-standing problem. We have a clear manifesto commitment to deliver on that, and we intend to publish details of how we plan to do that this year. I've been working with the Prime Minister on it. Clearly, before the pandemic, we were starting to work immediately after the election on this. We did engage then in cross-party engagement. I put out a call, as you mentioned, for cross-party suggestions and input. We've received quite a lot of that, and that's been part of our considerations. And I hope that we can come forward with a plan that can work and can carry public broad consensus. Now, it is more challenging to deliver this in more difficult economic times. That is obvious and clear. What we need to do, though, is put in place a long-term plan that will bring about a solution to this problem. At the same time, there are many, many other improvements to the delivery of social care that we can make, as well as addressing this issue of the funding reform. And many of those are contained in the white paper that I set out last month, on which there'll be a bill in due course, to bring an integration between health and social care formally, and much more so than we've had until now, because that is part of the solution to this significant problem. Even that part of the solution, the integration of health and social care, is an issue that's eluded governments of all stripes over many, many years. And I'm absolutely delighted to have been able to set out that white paper and to bring forward the bill in due course. On the second part of you, I've completely forgotten your second question. I should have written it down, sorry.
One-off bonus for Scots.
Oh, yes. The administration in Edinburgh take their decisions in terms of how they run the NHS. That isn't the approach that we have chosen to take here. And obviously, the matters of pay will go to the pay review body. But we have set out what is affordable given the very significant challenges to the public finances. Next question is John Johnson from Politics Home.
Good afternoon, Health Secretary. 2 quick questions, if I may. Earlier today, the Scottish Conservative leader, Douglas Ross, said that test and trace in the early stages of the pandemic did not work as well as it should have, and that he believed government ministers would accept that. Do you accept that analysis? And if not, why not? And secondly, Conservative MPs, including the chair of the Education Select Committee, have called for further evidence to be published over the weekend regarding the use of face masks in schools. Do you have any plans to explain to parents and teachers why that guidance has been issued, to reassure them that when pupils go back on Monday, that they're making the right decision by asking children to wear face masks?
Thanks, John. On that second question, I'm going to ask Susan to give a clinical answer. On the first question, of course, at the start of this pandemic, test and trace didn't exist. We developed the first test. Public Health England did that, and they did it within about a month of first discovering about this virus in the first place. So, of course, there's been a programme of constant improvement, and it's testament to that improvement that we now have turnaround times of under 24 hours in the vast majority of tests right across the UK. We have this huge sequencing capacity, which is the biggest in the world as a proportion of our population by a huge margin. We have contact tracing that reaches over 90% of positive cases and over 90% of their contacts, and again, very, very rapid speeds, which is an incredible achievement of the team to have built all of this. It means that we are in a better place to deal with a pandemic like this than before, and it's been because we've built it all the way through. That's been a very important part of what we've had to do. And I've spoken at this podium many times about the work that's gone on to make all of that happen. Susan.
Thank you. So our face coverings and face mask group have reviewed the evidence and also looked at the variant that we have circulating, B117. It was with that variant and with the increased transmissions that we were seeing around the school environment, not just in the school, but on the way to school, especially in secondary schools, that the advice for secondary school children to wear masks in the classroom and in corridors whilst moving around the school came as part of the advice package to reduce the risk in secondary schools on the return on March the 8th. That goes hand in hand with the testing that we're advising schools to do to also reduce the risk, along with all of the other measures the schools have put into play. And this is all there to reduce the risk of transmission in schools, to allow our children to continue their education safely, and to ensure that we have the least amount of rises that we can possibly hope for with increased mixing around return to schools next week.
Thanks very much, Susan. Final question, Megan Ford from the Nursing Times.
Good evening. Nurses are considering industrial action, and others may quit altogether following the news that they might receive just a 1% pay rise after a year of COVID-19. So my question is, how do you expect to stabilise the NHS and complete the vaccination programme without nurses on the ground?
Well, Megan, it's an incredibly important point that we need more nurses, not just the nurses who we have now. And we have a clear manifesto commitment to 50,000 more nurses in the NHS. And I'm delighted that there's more than 10,000 more nurses who've joined the NHS over the last 12 months. Also, we've seen an increase in 34%, so more than a third, in the applications to nursing. And of course, over the past 3 years, nurses have had a 12% pay rise. And I bow to nobody in my admiration for nurses. In fact, I learned that at the knee of my grandmother, who was a nurse and worked nights at the Pilgrim Hospital in Boston. The challenge is that the nation's finances are tight, and whilst everybody else in the public sector is going to have a pay freeze, we are able to to propose a pay rise for nurses at 1%. I entirely appreciate that reflects the difficult financial circumstances that the country is in. But what I'd say to every nurse who's watching and everybody who has worked so hard is we have, over this pandemic, pulled together in an incredible way. And I really hope that we can continue doing that, both to deliver for patients and also to support our NHS and to welcome many, many more nurses into the NHS over the years ahead. Thanks very much, Megan, and thanks to all. That ends today's coronavirus briefing.